County Native American Indian Commission, we welcome you to our COVID vaccine town hall. We particularly acknowledge the California Native Vote Project for their support of this event and thank the Los Angeles County Department of Public Health for your presence. My name is Dr. Andrea Garcia. I'm Mandan, Hidatsa, Arikara, and Mexican, and I'm also a mayoral appointed commissioner on the Los Angeles Native Commission, and I will be moderating today's superstar panel who will introduce themselves a little later. But we'd first like to start off this event in a good way, so we'll turn it over to the esteemed Rudy Ortega, Tribal President of the Fernandino Tataviam Band of Mission Indians, to start us off with a blessing. Thanks, Rudy.
I'm going to thank you, Andrea, for the introduction. Hello, everyone. My name is Rudy Ortega Jr. I'm the Tribal President for the Fernandino Tataviam Band of Mission Indians. As well, I'm a commissioner alongside Andrea for the Los Angeles City County Native American Indian Commission. I'm Supervisor Sheila Keel appointee to the commission and currently the Vice Chair to the commission as well. And we welcome everyone to today's program. And at this point, I want to acknowledge the tribes of Los Angeles that we reside on, my tribe, the Fernandino Tatavia, the Gabrielino Tongva, the Waneno Hashiman, and the Chumash people who have shared these areas and our surrounding neighboring tribes as well, from San Manuel, Morongo, and many, many others in Southern California who access our ancestral territories. With that, I'd like to begin with a song, a welcome song. It's in Pipi Madam language. The song, essentially, the words are, oh, you're welcome to come into this space. So I'd like to do that this time for the song. Thank you.
Thanks, Rudy, for opening us up. We always appreciate everything you do for the community, and we thank you so much. So just a couple housekeeping things before we dive into this exciting panel. One is that if you have not submitted questions already, please feel free to type in your questions into the Commission's live video feed. We'll do our best to get to as many questions as possible. And secondly, the California Native Vote Project has graciously offered some raffle items in the form of Target gift cards. Woo! So to enter the raffle, please visit the link provided in the chat, and then Jesse should be popping it in into our Facebook stream right now. And please fill out the Google form. Winners will be contacted by phone or email after the town hall has ended. So don't miss out on the raffle. And I'd also like to take a couple seconds to acknowledge those that we have lost due to COVID and those who are experiencing grief or who are perhaps dealing with other ramifications due to COVID. We care deeply for you, we support you, and we hope the information you learned tonight is helpful. We'll be sharing about all of the wonderful community-based organizations at the end of this town hall who are eager to welcome and support you as well. So please take advantage of those in the community here who want to help. So we're just going to dive right in. Rudy, what has been the impact of COVID-19 on your tribe, and why has it been important for your tribe to get involved in testing, education, and other COVID-related efforts?
Those are great questions. And one of the reasons why, just as many other communities are struggling with COVID and who've been impacted, one of the positions that my tribe is that we're a state tribe and not a federally recognized tribe. So we have to be creative in how we access resources and who we partner up to make sure we bring awareness and proper education to our community. So we did multiple of things to be engaged and bring awareness and being proactive with our community. One, we immediately provided food assistance to all of our elders and pregnant women and disabled family members. But what was essential is that we teamed up with CORE here in Los Angeles, and through the efforts with the commission as well that guided us with the information to who to contact, brought testing to where our office is at in the city of San Fernando, Los Angeles County, to bring testing to all of our tribal people, and not just to our tribal people, but also to the community that we reside in around the neighborhoods around us. So that brought the comfort, because one, when the tribe went out and said it's okay to be tested, just get tested, just be aware, just bring proper guidance and protection for our families so it doesn't spread out further. People got comfortable in our own tribal community to go out and get tested. So they weren't going to the other testing sites like Dodger Stadium here in Los Angeles or any other spaces. They were really waiting for tribal leadership and the tribe to say, you know, we went out, we vetted them in, we had the conversations, and we understood the importance of testing. So that was one element that we've done for that. Now the site does the vaccine today, still operational. It also does a flu shot. So it's a walk up. So you're not driving up to other like the Dodger Stadium or CSUN or Magic Mountain. This one you can walk up to, which is important because many of our elders don't drive anymore, or if they take an Uber, they're savvy enough, because I did have one elder took an Uber to the testing site, but it was a drive up. They managed to give her the vaccine, but they made it wear longer because it was supposed to be a drive up. So those are the obstacles that I see that our larger governments and other are facing, is that how do you service those individuals? The other part that we're facing in this pandemic is everything's technology is fantastic, and this technology has been around for many years, and we use it for businesses. The unfortunate downside is that many of our elders can't get access to it. How do they engage? So now we're seeing them cycling down on mental depression. And so, you know, we've created a program back in December for 30 days where our tribal community, we had the younger generation reached out, phone called our elders, provided education, cultural education, engagement, pre-recorded videos, showed them how to log on, those kind of tools. And they were happy to have that one-on-one conversation over their old-fashioned phone, because we're so used to texting and video conferencing like Zoom and Facebook Messenger, all that stuff. But these elders are not there. You know, they prefer that person to person or that phone call, you know, and that one phone call, how you doing? Did you have coffee? That really sparked up enjoyment in our elders community here. So that's what we've done. But essentially, you know, help fight off and answer questions. Even the questions around the vaccine is the trusting, you know, do we trust it? Do we take it? And it's brand new to come out. And it's okay those questions are important questions, and they're needed questions. And the thing is that there's still a lot of new coming from it, where we're finding out where the tribe ourselves is meeting in these spaces, so we can bring the proper facts about the vaccine. And be prepared to answer those questions for our community, because even ourselves, we need to ask those questions. You know, is it a safe vaccine? You know, what's the effects to it? I have allergies, you know, those kind of things. I just came off, recently had COVID. Do I take it now? You know, when's the proper time? So without those questions, and even us to ask those questions, then we're not really prepared to answer those questions to the community and give them comfort. And that's what builds comfort. So they can see that we have the same concerns as they do, and that we're just not ushering out something that may be harmful, but we want to make sure it's something that's protective for them as well. So that's what we found, the importance to bring the testing to San Fernando. We, you know, partnering up with CORE and the city of San Fernando and the county of Los Angeles, and as well as the Indian Commission, to make sure that these vital, important resources are given out to the tribal community, especially a community like mine. Like I said, it's state recognized. So we're the very last anyone thinks about. You know, if it's our own people, no one's thinking about our community. And just a little bit of statistics, we have 1,000 people enrolled in our tribe, just a little under 1,000. We already had 38 people infected, and out of 38 people, we have 3 people passed away. So that percentage means that we're over 5% ratio of someone getting infected in my tribal community and passing. So it's a very serious disease. It's a real disease, and it's something that we can really defeat by working together and understanding the proper information.
Thanks, Rudy. I think it's amazing. Again, like you are the first peoples of this land, the caretakers of everyone here. And I think it's really remarkable that in a time like now, you are doing just that, and not only taking care of your own tribal members, but the surrounding community. So I just wanted to commend all of the efforts. I definitely knew about the testing and some of the resources that you were able to help with in the food boxes earlier on, but the fact that it's been long standing and is still there, and is accessible to your local community and is trusted is amazing. So thank you so much. And again, we appreciate every single thing you do, and your tribe for the community. Is there any other last departing comments that you'd like to make? Or
And I think just, what I've shared and everything, and learning from everyone else on this panel today, just to bring to the community as well.
Awesome, thank you. Yeah, so we will definitely get to some of those questions that you highlighted, and we hope that everybody walks away with some knowledge of that. So thanks again, Rudy.
Thank you.
Awesome. So we will transition now to Abigail Echohawk, who's the Executive Director of the Urban Indian Health Institute. I haven't told her this yet. I probably should have told her before we went live, but I have a serious nerd crush on you and all of your work, and I have nothing but respect for the entire UIHI team. So Abigail, with that awkward introduction, I'd like you to start off by introducing yourself and telling us a little bit about the Urban Indian Health Institute. And then if you can, go ahead and let us know what you've learned about how our community is feeling about vaccination through your research efforts.
Well, thank you so much. And I've heard a lot about you and have the same nerd crush. So it's really exciting to be able to be part of this. And thank you all so much for the invitation to contribute in some small way to this conversation, and to our tribal leader who just shared what's going on in his community. Thank you so much for your dedication to your people and to all Native people. It's through strong tribal leadership that we are going to end this pandemic and ensure that our community just doesn't survive it, but thrives within it. And so thank you so much for your leadership. I'm Abigail Echohawk. I'm an enrolled citizen of the Pawnee Nation of Oklahoma on my father's side, and I was born and raised in the heart of Alaska, among the Upper Athabascan people on my mother's side. So I'm very blessed to have been raised in a very rural part of Alaska, and I am currently sitting in my office at the Seattle Indian Health Board on the Coast Salish lands of Washington State. I'm in the Seattle Indian Health Board, which is a federally qualified urban Indian healthcare center. And I am the executive vice president of the Seattle Indian Health Board, where currently I can see people going into our vaccination clinic out my window below. In my role, I direct the Urban Indian Health Institute. So the Urban Indian Health Institute is one of 12 tribal epidemiology centers across the United States. I used to always have to explain what epidemiology is, but since COVID-19, people actually hear it on the news every day. So what we do is we look at how disease affects our communities across time spans. So epidemiology is very important in the middle of COVID-19 right now, and understanding what's happening with this virus, how it's affecting, and where we need to intervene. So out of the 12 tribal epidemiology centers, the other 11 work with the federally recognized tribes and regions across the United States. So there's one that's located in California that works specifically with the California tribes. The Urban Indian Health Institute is unique in that we focus on the urban dwelling American Indian and Alaska Native people like myself, tribal people who live in large urban settings like LA, Seattle, Denver, New York. And our work is to ensure that we're represented in the epidemiology and in data collection and research. And so we're fighting every single day to ensure that we are not eliminated in the data, because we know that that data is essential to pushing the federal government, our states and our counties, to fulfill the federal trust responsibility and our treaty rights. And so we're fighting every single day. And it has been an honor and a privilege, and definitely much harder in the midst of this pandemic. I was telling my team recently, I feel like I haven't slept since February of last year. And it is a privilege to be in a place where our skills that we're grounded in our ancestors and our upbringings as Native people. And then we were able to supplement with Western science, have been of use of our people in this time. So what has the Urban Indian Health Institute found out about COVID-19 in this community? Well, first of all, is that if we found that the tribal epidemiology centers and Native communities, that if we are not fighting for visibility, they're leaving us out of the data and nobody knows what's happening or the impact of our relatives COVID-19 is having. I was co-author on several studies that were published by the CDC. It had other tribal epidemiology centers, members of the CDC and others. And what we found was nationally, Native people are 3.5 times more likely to be diagnosed with COVID-19 than non-Hispanic whites. And we were 1.8 times more likely to die as a result of that. There is some other research that's been done, and that group actually found that we're almost 2.5 times more likely to die when they looked at where missing data was. And so we know our communities right now are suffering, that we are more at risk of COVID-19, not because we're Native. Being a Native person, being a Pawnee woman is what makes me strong. Being a Pawnee woman in a country that has been trying to kill me and my relatives for 500 years is what puts me more at risk for COVID-19. And we've seen that evidence by our people having more likely to have obesity, diabetes, cardiovascular disease, all of the underlying risk factors that makes getting COVID-19 more risky. And also living in impoverished areas where we're more likely to be in crowded homes and not have access to running water or electricity. Those things, which have been a result of the way the federal government has treated and continues to treat our people, makes us more at risk. But what we also see is the strengths of our community is what has allowed us to, again, we are not just going to survive this pandemic. We're going to find the opportunities for our community to thrive, like our tribal leader just showed us. We have taken actions to protect our elders. We've seen community groups, tribes, leaders. Native communities were the very first ones to begin to follow and implement safety public health measures like masking and home quarantines, and some reservations shut down their borders. We did it first. And when we look at the vaccination rates right now, we're actually seeing nationwide that Native communities that have an Indian Health Service, a tribally operated or urban Indian programs that are funded by the Indian Health Service, they're doing a better job at vaccinating their people than the states and the counties are. And so we're actually leading in doing vaccinations. My friends at the Bay Mills community in Michigan, they have 50% of their population vaccinated. There are villages in Alaska, 100% vaccinated right now, and they flew those in and took them by dog sled into these villages. Here at the Seattle Indian Health Board, 100% of our elders in our elders program, 100% are vaccinated. And that is an incredible success. We are leading. They need to come to Native people, not because they think we have all the problems, but because we have all of the answers. However, we know that a lot of our urban Indian people who don't have access to tribal facilities, who are state recognized tribes, are not able to access federally funded IHS programs, are not getting the same amount of access. And in fact, we're seeing across the country, Native people who have the ability are making their way back to their reservations to try to get access to the vaccines that are happening and the access that they could get on their reservations. I know of friends who have driven cross country from one city into their reservation to try to get vaccinated. And most of the time, while they are getting that, it's overstretching our systems because we're chronically underfunded. And so a lot of our programs are juggling what services they're able to provide, how much vaccinations they can provide. And there's also a lot of misunderstandings that are happening. In one of the counties that I'm working in, they are actually finding that other facilities, hospitals, and pharmacies are turning Native people away and saying, go to the Indian clinic. But the Native clinic doesn't actually have the number of vaccines they need to vaccinate all Native people. That's not how it's supposed to work. From an equity perspective, this country should be vaccinating those most at risk for hospitalizations, for death. And we are seeing nationally with the bad data that does exist, that it's a majority of middle class and up white people who have been getting the vaccination. So while Indian country is doing the best, we still are seeing these incredible disparities. And so we are working and fighting, and you can find a lot of resources on my website, uihi.org, very specifically talking about our tribal leader just talked about the safety of the vaccines. You can actually find on our website information on Moderna and Pfizer. And one of the key things that Native people always ask me, how do I know it's safe for me as a Native person? We've actually taken a look at and found out how many Native people were included in the clinical trials. So the testing of that vaccine, how many of those people were Native? It's about 1% for both Pfizer and Moderna. I wish there was more, but there were Native people in this testing. And Moderna was tested on more than 30,000 people. Pfizer was tested on more than 42,000 people. There is a lot of research that's gone into this to establish the safety of these vaccines. And we'll probably have the Johnson & Johnson vaccine here in the next couple of weeks. They haven't put out their numbers of Native people yet, but my team and I will be putting together that information because, and I'll just end with this. We did the only national survey that's been done of Native people across the country on their perceptions, beliefs, and hesitations around the vaccine. And what we found is that Native people, 75% who were surveyed, said they would get the vaccine. And most of them said the reason they would get the vaccine is not because they were concerned about themselves, but 74% said they would get the vaccine because they were going to get it for their community, for their family, and for their tribe. That is the innate strength we have as Native people, because the rest of the country right now is making a decision based on their individualism. They aren't thinking about themselves as a community. That is the strength of our communities, to think about each other. What does it take to be a good ancestor for the next generations? And how do we do that well? So even though 75% were willing to get vaccinated, there were still hesitations. And so my team and I know lots of others, are working towards getting people the information they need so that they can overcome their hesitations, like knowing how many Native people were in these clinical trials, so that we can get our relatives what they need to make a good decision for the health and well-being of our community, because it takes all of us to be good ancestors for our next generations.
Yes. Abigail, every time I hear you talk, I am so excited and so filled with joy and fire in my belly and inspiration, because you speak the truth of our Native people. You definitely touch on the values of Native people, thinking about the collective. And so I just want to thank you for lifting up everything that's beautiful and positive about our community. And I especially want to thank Urban Indian Health Institute, your organization, for doing the research, right? For backing it with evidence in a time when we don't have a lot of data, but for doing the research and telling our community, like, yes, there is a lot of mistrust in the past due to all of these things that happened, for sure. But we actually asked our community, and 75% of people said we actually want to get vaccinated because we care about our relatives. So I can't thank you enough. Again, I'm a huge fan, and you know what? We might have time. I want our viewers to know about another reason why you were, well, you're always in the news, in the media, but in particular, you made a dress recently, and it ended up being in Vogue, which is amazing. And I'm wondering if you can tell us how that dress ties into what we're talking about today, and how you saw and took something that was discouraging and made something beautiful out of it, if you wouldn't mind sharing with us.
Sure, thanks. I actually haven't talked about this dress publicly at all, except for in that article. So I appreciate the opportunity to share about it. So in the beginning of the pandemic in February, Seattle was the epicenter of COVID. We had the very first confirmed cases and the first cluster of cases. And so quickly our clinic became overwhelmed by Native people who were rightfully concerned, wanting to get testing, and we ran out of PPE. So we didn't have masks, gowns. We actually had physicians who were sewing. One of our physicians was sewing fabric masks so they could change them out in between appointments, which is not as safe as we need our providers to be. Our executive leadership team was washing scrubs at our homes because we couldn't find places that would wash doctor scrubs and that we could get them. It was hard. It was a really hard time. And so we asked our state, our federal, and our county partners to send us PPE that we were in desperate need. And we received a big box at our clinic. And when we opened that box, instead of finding gowns or masks, What we found instead was a big box of body bags. We're a community health center. If somebody dies here, we call an ambulance. We're not a hospital. There was no reason to send us body bags, and it was devastating. I remember going home after the CEO and myself opened them up because we almost just couldn't believe what we had. I actually opened it up and took the toe tags out and was like, is this really what you sent us? I remember going home that night and I sat on my chair and cried because it was, to me, both a literal example of how they were treating Native people in the midst of this pandemic, but it was also a metaphor for how Native people have been treated by this country. They'll bury us, but they won't do the things that are necessary for us to thrive and survive. And so it was pretty devastating. And actually, when we finally got PPE, it did not come from the federal government, the Indian Health Service, or our county. It came from a local business called 8th Generation, who had connections in China with manufacturers of masks, and they brought us 10,000 masks before we got PPE from the people who are supposed to provide it for us. That was our Native community stepping up and caring for each other. So I asked our CEO, I was like, what are we going to do with these? We can't use them. We don't use them. And I said, can I take it home? Because one of the things I do is I do art at home as a way to cope with all the trauma that I have to go through in my job. And she said I could. And so I took those body bags home, and they sat for a while. I kind of took them out. My children kept saying, move your body bags, Mom. It got weird for a minute. But in looking at those, I was taught by my aunties on how to make regalia. And when you make regalia, it's always done in prayer and in healing and about the love for the next generations. And so I took one of those body bags and I made it into a ribbon dress. And in each ribbon, I stitched in red, which is the color I was taught is the color of prayer. And each stitch was a prayer for the survival of the next generations. I lined it with fabric that is comes from the Woodlands people, the Anishinaabe people. And because I had learned from my Anishinaabe sisters what it means to be an Indigenous scientist grounded in our culture and our tradition, and that's where our healing comes from. So I put that in the inside of the body bag. I wrote around the edges of where a zipper or body would be zipped into, something that I say in my head to myself all the time, which is I'm a tangible manifestation of my ancestors' resiliency. I come from a people, and I stand here today or sit here today because of them. And then around the front of it, I put a bunch of mirrors, which I learned from a Northern Cheyenne sister of mine, who, when we talk about regalia, that the mirrors deflect and they also reflect back the injustice on those that are causing the injustice against us. And then on the front of the dress has red hands. And that comes from the work that I've done over the years on missing and murdered Indigenous women and girls. And when I did that, my husband said, he's like, oh, you know, he's like, you're leaving your fingerprints on that. What if somebody sees this? He's like, that could be dangerous. And I told him, I actually am doing that on purpose. And I told my sons, if I ever go missing, you can find my fingerprints on this dress. I have saved them for you. So you could identify my body if you have to. The dress itself was a healing from the trauma. It holds practical purposes. If my children would have my fingerprints if I was to go missing, because I've been in situations where I thought that probably was going to happen. And it was a way to say, you send us body bags, we turn them into beauty, strength, and resiliency, because all of us are the tangible manifestation of our ancestors' resiliency. And resiliency in the dictionary is a noun. I looked it up. But for Native people, resiliency is an action. And every single one of us are taking action, whether it's masking, whether it's getting vaccines, whether it's, you know, I made that dress for me. It's hanging in my living room and I touch it when I walk by, because I needed to have a traditional way of dealing with the trauma in my life so I can continue to serve my people. So healing is an act of resiliency. And that dress is part of that. It's the resiliency that I needed in order to come back into work and say, okay, you gave us body bags. We're not going to accept that ever for our people. We will only accept a future where we are thriving and ever continuing.
Thank you so much for speaking about this in a public setting for the first time. We really appreciate, I know that a lot goes into it, your entire heart, your being, your soul, when you're doing activities like that. and trying to heal from that. So we thank you again. We definitely have more questions for you in a little bit, but we're going to transition right now, and all of the praise and thanks. So we are now transitioning to another woman warrior in our local community. She is one of our hardest working healthcare heroes who very quietly and graciously moves mountains every day for our local community. So Janelle McGee, I'm wondering if you can please introduce yourself and tell us about the good work that UAII, United American Indian Involvement, is doing around COVID testing and vaccination. And you're on mute.
Hi, everyone. My name is Janelle McGee, and I am the Director of Health Services here at United American Indian Involvement. I'm so happy to be here today among these other great panelists. For those of you who don't know about our agency, United American Indian Involvement is a really comprehensive urban Indian health organization, and we provide care and services to the American Indian, Alaska Native population here in Los Angeles and Orange counties. Our client base here at UAII is made up of over 200 federally recognized tribal members. Our service includes behavioral and mental health, substance abuse treatment, workforce development, child abuse treatment program, domestic violence, senior services. We have an array of youth services, including Central High School. And lastly, the health services that we provide here in the Los Angeles American Indian Health Project, which includes the community clinic, case management, and public health. Here in the Health Project, we are funded by IHS, which is Indian Health Service. So our eligibility to receive services is based on IHS's Urban Indian eligibility requirements. If you have questions about if you qualify or not or are eligible for our services, you can call UAII and speak to one of our case managers, and they can answer any questions you might have. And they can also assist you through our registration process, as well as triage you for any needs that you might have. And they can provide referrals into our clinic or connect you with other departments in our agency as needed. To receive services here in the Health Project, there are no income restrictions. Anyone who is eligible to receive our services is welcome here. We have a lot of people that come to the clinic, even if they have their own private insurance. They like to be seen by our Native providers. They're treated with respect. Their cultural needs are of a concern with our providers, and they trust the service that they provide here and the comprehensive care that we're able to provide. When COVID-19 pandemic began and the first safer at home orders were announced, the Health Project needed to jump into action to take care of our community members who needed us. Our Health Project case management team, as well as our health educators and other staff, we began making daily welfare check calls to our elders and other members and families in the community who we thought may need some extra help during this time. These calls were really appreciated by the community, who we found out through talking to them, they felt really alone and they were scared. And sometimes the calls from our team were the only touch with outside contact that they had with anybody. So our team worked with these people. We got them into the clinic if they needed. We referred them for behavioral and mental health issues if they were depressed. And we also set up our clients for delivery of needed items. We really knew that we had to mobilize. We needed to get into our community. People were scared to leave their houses. So our deliveries consisted of food boxes. And remember, this is at the beginning, everybody was scared, store shelves were empty. So we were providing sanitizer, delivering gloves, masks, diapers, wipes, feminine hygiene products, other essential items like paper products, fresh produce. Our community reach for those deliveries totaled about 1,500 clients and family members so far that were able to benefit from the deliveries we made. We also formed a COVID-19 response team, which includes community liaisons that are continuing outreach into the community, providing education, not only to our current community members, but really reaching out and working with our partners and other community-based organizations. Last April, we began testing for COVID-19. We started out with lab sendouts, but then IHS provided us with a point-of-care Abbott testing machine, and we were able to get clients their test results within their clinic visit, which was really a game changer for us, being able to give people their results right then and there. To encourage our community to come in for testing, we offered and still are offering all of our registered clients a $50 gift card incentive. Our AIAN community is really responsive to that, coming in and getting tested, and they also receive education while they're on site. And also by testing in the clinic, we really have that hard data that we're collecting and reporting on, and contributing to make sure our community is properly represented in the data we report on. We do report to the UIHI also. So far, we've screened 1,277 patients, 356 tested, and 33 that have tested positive. We began offering special support services to our clients who tested positive. Our case managers, who are part of the healthcare team, have been reaching out to those who test positive to see if any extra support may be needed during this time. Our funding is limited, but we try to do what we can. We've been helping clients with their rent, utilities, paying for medication. And we also recently started using a contactless grocery delivery system. We had a sudden rise in COVID-19 positive tests in the clinic, and this service became especially important as our clients, of course, always have a need for groceries, but we need them to stay in quarantine. So in an effort to keep our clients safe at home and to prevent spreading COVID further into their community, this new service for grocery delivery was implemented, and it got really good feedback because the turnaround time is only a few hours, and the clients get to fill up their grocery cart with items they select at the store they select up to the specified dollar amount that's allotted. So that got a lot of really good feedback, and the clients were really happy with that. In December, we in the clinic began vaccinating for COVID-19. Our vaccines are supplied to us by IHS. So we do have to follow their eligibility guidelines. We follow the CDC recommendations when creating our prioritization metric. So far, our clinic has received 900 doses of the Moderna vaccine, which is for people age 18 and older. We had just received some of those doses, but so far we have administered 620 of those doses. Our clients can call and ask to be put on the COVID-19 interest list, and our registered nurse will triage them into the correct tiered level and then call them in and schedule them into one of our dedicated vaccine days. Currently, our vaccine days are Mondays and Tuesdays, and that's all we do is vaccines all day on Mondays and Tuesdays. We maintain a wait list of clients who can indicate if they can come in at the last minute to avoid any doses being wasted. We don't want to waste anything. So we do have a protocol in place to make sure that doesn't happen. And for anyone who's not currently a client but is interested in receiving an immunization from our community clinic, we are directing people to call and speak with a case manager. The case manager will help determine your eligibility and will guide you through the registration process and work with you to get documents you might need so that your name can be added to the call list for the clinic. We've been running reports and doing outreach to our active client database. We've also been working with some of our community partners and work groups to help spread the word about our vaccine availability, as well as social media and other media outlets. But if anybody has any questions or needs any more information, you can visit our website at uaii.org, or you can call the agency and speak with a case manager. At our website, you can also get more information about the other services in our other departments who have different eligibility, may have different eligibility requirements than us, as they have different funding sources. So I hope that you can find the information you need there. Thank you so much.
Janelle, thank you so much. You have been part of every single group, dealing with every single new initiative, and we just deeply, deeply appreciate your commitment to the community. So I hear what you said at the last part. If folks have questions about their eligibility to go ahead and call and talk to a case manager, that is a question that we're getting on our live Facebook feed. So we'll just go ahead and direct that. And it looks like some of the UAII staff have dropped in a link into the chat, as well as a phone number and an email to find out more about how to get vaccinated or receive the other services. So thank you, UAII, for being on top of that. The other thing that I just wanted to underscore and put an exclamation point next to is kudos. 620 vaccines given is amazing. And you talked about how you're taking care of the community, how UAII is taking care of the community in a very holistic sense. And so helping with rent and utilities and groceries, and when folks are tested positive, you know, the extra support that they receive. So again, like, hats off, and we thank you so very much. Is there anything else you'd like to add?
No, thank you.
Okay. All right. Well, thanks again, Janelle. And again, to our audience, you have that information in the chat, and we'll be sharing some more later. So with that, we're just going to jump right into the questions that everybody has today. So I would like to introduce Dr. Paul Simon. Dr. Simon has been a mentor of mine since I worked in his division as a resident, actually, in general and preventive medicine. And we're extremely grateful to have him here. He's actually no stranger to Native health and data. And in fact, he's even visited UAII in the years past for a community gathering. So we'll go ahead and ask Dr. Simon to please introduce yourself, and if you have any opening comments, or if you just like to dive into questions.
Thank you, Andrea. And first, let me just say it's a great honor to be here with you all. And I am so inspired, frankly, by the other panelists, and humbled by the important work that you're doing. I actually have a number of questions that I'll probably have to follow up with them afterwards. For example, I didn't realize that there was a direct allocation from the Indian Health Service to clinics here within Los Angeles County, and I want to learn more about that. It's obviously been a devastating year. In Los Angeles County, well, let me first just mention, I'm with the LA County Department of Public Health. I'm the Chief Science Officer, which means I do a lot of what actually Abigail described. It's a lot of epidemiology and data, and trying to understand what's happening in our population here in Los Angeles County, which is a challenge because we're so large. We have 10 million residents here in Los Angeles County and over 4,000 square miles of land, urban, suburban, and even some rural. And as I think everybody knows, great diversity in the population, and that's both a blessing but also a challenge in terms of understanding, you know, what's happening within different communities, but also a challenge in addressing the needs of the various communities. And I'll say, just, you know, I'll just acknowledge here at the beginning that we see terrible inequities, both in the impacts of the pandemic here across different communities, but also we're seeing very graphically now the inequities in the delivery of vaccine. While I think we've done a pretty good job of getting the vaccine out, given our limited supplies, we've now received about 1.8 million doses of vaccine, and we've been able to vaccinate, I think, well, I'm forgetting the number. I think it's about 1.2 or 1.3 million persons, with about 500,000 having received both doses of either the Moderna or the Pfizer vaccine, meaning that those folks are fully vaccinated. We've now, for the first time over the last couple of weeks, been able to look at it geographically, and we see major gaps. For example, in some of the more affluent communities, we see among the 65 and older, for example, which is one of our eligibility groups, well over 50% of the population vaccinated. But then in other areas of the county, for example, South Los Angeles, East Los Angeles, the East San Fernando Valley, the Antelope Valley, down it's 5, 10, 15%. So terrible disparities. I have looked actually at the Native population vaccination coverage rates for those 65 and older. And it's interesting to me. There is a disparity. We see the highest vaccination coverage rates among the 65 and older. In the white population, it's 48% vaccinated as of February 20th. In the Asian population, 45%. The Native American population, 38%, so lower. The Latino population, 34%, and the African American population, 29%. So a big gap. We do recognize that we need to move beyond these large community vaccination sites like these, what we call megapods, points of dispensing, which have done a pretty good job of vaccinating large numbers, but not, again, addressing our equity objectives. And so we're finding we do have to just have deeper partnerships, frankly, with various communities to help people access the needed services. Many people, particularly seniors, aren't very comfortable on the internet, for example, and it's hard enough for anybody to get an appointment for a vaccination using the appointment system on the internet. So we are working with various community organizations to provide more support and actually register people on site. I think Janelle may have mentioned that, but if not, I've heard a number of other community organizations that are seeing some success by inviting people to their trusted, locations to receive the services and then helping them register on site. And so I'm happy to answer questions today, but I'm very eager to hear suggestions that people have for how we can improve our services and support for your communities. We recognize it's a tremendous challenge, and in order for us to be successful, we really have to, again, better understand the needs and more actively partner with you all and the many other communities here in the county.
Yeah, absolutely. Thank you for that offer to hear the needs. We can talk about that all day. I think it was underscored pretty well by Janelle and Abigail that, our communities know how to take care of each other. And we've been doing a really excellent job when we get the direct vaccine allocations. And so I think that's just one strategy. We can definitely invite, the folks on this panel to weigh in on that. But I think for the purpose of today, we definitely wanted to just get the information out there to our community about all of their questions. So we'll just go ahead and dive into that. So I think just starting at the basic level, Dr. Simon, can you just tell us, how does the vaccine work? And related, can someone get coronavirus from the vaccine? Will it change their DNA? And what's it actually made out of? We want to start right there at the beginning.
Those are great questions. So there, as many folks know, there are two vaccines that have been approved. One is the Moderna vaccine, the other is the Pfizer vaccine, and both of them are what are called messenger RNA vaccines. They're actually the first approved vaccines that are messenger RNA, although this technology has been used for over a decade for other therapeutics, other treatment strategies. So it's not a new technology, but relatively new application for vaccines. One cannot catch the coronavirus from these vaccines because there's no live virus, killed virus, or even component of the virus within these vaccines. The messenger RNA, which is the genetic material that's in the coronavirus, it's actually manufactured in a laboratory. It's synthetic, and then it's placed within a sort of a surface structure of lipids or fats that stabilize it. And then when it's injected into the body, the messenger RNA is released. It does enter the cells of the body, but it doesn't enter the nucleus of those cells where the body's DNA is. It never touches the body's DNA, but it is used within the cells. It triggers the cells to make a protein. It's called a spike protein, which is the very protein that's on the surface of the coronavirus. And so when those spike proteins that have been manufactured within the cell from the vaccine are released from the cell, it triggers the immune system to produce antibodies that fight, that then will kill the virus if one becomes exposed to the virus. So the two approved vaccines have been found both in the vaccine trials and now in our experience where we've vaccinated more than 40 million people across the country. The two vaccines have been found to be very safe. Very happy about that. We didn't know that would necessarily be the case. That's why we did the vaccine trials. There's a third vaccine that's we think about to be approved. It's called the Johnson & Johnson vaccine, or Janssen vaccine. It's a different kind of vaccine because it doesn't use messenger RNA. It uses another virus called an adenovirus. But again, not a live adenovirus, but a modified adenovirus that won't infect anybody. And the vaccine then programs adenovirus to produce the spike protein, which then again triggers the immune system to develop antibodies. The advantage of the Johnson & Johnson vaccine is it only requires one. Moderna and Pfizer require 2 doses. And the Johnson & Johnson vaccine is quite safe as well. All 3 vaccines are very effective. We didn't know, again, going in, what the vaccine trials would show, but we were so pleasantly surprised when the results were released that the vaccines were as effective as they were in the trials, and it seemed to continue to be. And so I've been pretty confident in recommending that most people be vaccinated, but I do understand that many people have lots of concerns. And so it's important to try to address those concerns.
Yeah, so I'm glad you mentioned concerns, and maybe we can direct this question to Abigail. Abigail, so a lot of people in general are asking, why should Native people trust this vaccine?
Yeah, that's a really good question, because trusting the federal government is never really served Native people well. You know, we do know we have a history of things such as forced sterilization. We have seen the chronic underfunding or mistreatment of Native people in medical services. So there's a lot of hesitancy and a lot of mistrust that needs to be overcome. So having counties that are willing to work hand in hand with communities, with community leadership, with community clinics is so key to helping to get the information, like Dr. Simon was just sharing, out to our communities. So one thing to know is that I know a lot of people are just starting to discover this, that one of the vaccines, the development was actually led by a woman of color, a Black woman. Very exciting. It's not something that we have seen previously in a lot of our major development of drugs. And so I think that's another question, is like, are people of color actually involved in this? And there was numerous people. Like I said before, there were Native people who participated in the clinical trials. I have members of my team who are sitting on the oversight community boards of these clinical trials, assisting and working to ensure Native people get the opportunity to participate if they so choose, and that Native communities and Native nations nationwide are making sure that those clinical trials are conducted in an ethical way that improve the health and well-being of our communities. And also, you know, when I think about our responsibility to be good ancestors, and our survey that we did that said 75% of people wanted to get vaccinated before their community, they also said they needed to make sure all of these things were overcome, and they wanted to see the trusted messengers. So they wanted to not see, you know, your governor get vaccinated. They wanted to see the elders in your community get vaccinated, and to tell them that this is something that they thought was good for our community. So our research study has actually helped inform campaigns, materials, and information so Native people can get the information they need in order to make a good decision. And this isn't about forcing people to get vaccinated at all. I would never want to force anybody to do anything. What we need to make sure is our community gets all of the resources they need in order to make a good decision. And I know one of the questions that we had gotten here, and I'm sure Dr. Simon probably has some feedback on too, is that here at our clinic in Seattle, and I also know I've been talking to clinics nationwide, There's concerns about whether or not pregnant women should get the vaccination. And the World Health Organization had actually put out and said that they don't believe that pregnant women should get the Moderna vaccine. But when we look at our organizations representing maternal and child health in the United States, they actually said, well, yes, we believe pregnant women should get the Moderna vaccine along with the Pfizer vaccine. And so there's even some debates within medical associations. And what folks need to know is that pregnant women are eligible to receive this vaccine. They were not included in the clinical trials. As of right now, with the monitoring, the very close monitoring that is happening of every single person who is getting a vaccination, they have not seen any detrimental results to pregnant women or their children when they're born. And this decision needs to be made with you and your provider. You need to sit down with your physician. You need to have a talk with your prenatal provider and make a good decision together for women and for all people who birth on whether or not getting the vaccine is right for you. And your physician, you'll talk about your allergies, they'll talk about what they feel is the best, and then they will work to get you access to the proper vaccine for you. So having those relationships with your providers are very important. Reaching out to community health centers like our Urban Indian Health Program there in LA County, and having those conversations if you are pregnant are very, very important so you can make a good decision for you, your family, and your child. And so there's a lot of these questions that are coming up. You can find resources specifically for Native people on uihi.org. And I'm sure that your county and your Urban Indian Health Program also has great resources. And, you know, getting the information you need to make the best choice for your family and your community, that's being a good ancestor.
Thank you. Thank you for that. So we'll just keep going down the list. A lot of people expressed uncertainty because these vaccines were developed so quickly. Why should they trust this technology? And isn't it too early to detect any side effects, is what someone asked. Dr. Simon, did you want to take a stab?
Sure, I can begin, and I'll be honest, I was concerned when I saw how rapidly the vaccines were being developed. What impressed me actually was the transparency in the process, and the media really covered this process so extensively. I found I was often learning things first in the media and then going to the research studies that they were referencing, the reports. And in addition, I think it's important to recognize that all the required steps in the evaluating the vaccines and then approving them were maintained. There are phase 1, phase 2, phase 3. It's just that those phases were sort of condensed or overlapped. And as an example, often in the vaccine development process, which can take years, a company will not manufacture the vaccine, commit the resources to manufacture large quantities of the vaccine until the vaccine has already been approved. We recognize we didn't have the luxury of time. And so I think our government and probably other governments paid these manufacturers, or in some cases, the manufacturers took their own risks and did produce the vaccine at large scale in anticipation, in their hope that the vaccine trials would prove that their vaccine was both safe and effective. And so once there was that approval, they were ready to distribute large amounts. And there have been other instances, several other companies that did commit resources to manufacturing, but then they had to end the process when the vaccine really wasn't panning out in the studies. So I think all in all, it was a good process, but I do agree actually with the point that was made in that question that you don't necessarily know everything you want to know about safety after the conclusion of a vaccine trial. Even with 70,000 people studied in these 2 vaccine trials, about half getting the vaccine, half not getting the vaccine, getting a placebo. You can learn a lot, but there are relatively rare side effects or bad reactions that could occur that you wouldn't necessarily detect in a vaccine trial. So I think, as Abigail mentioned, there has been continued monitoring. Again, about 45 million people now across our country have been vaccinated with pretty careful monitoring, and we've continued to see both safety, and now we're starting to get some data to suggest that indeed the vaccines are working pretty well.
Thank you for that.
And I would just add that we have to acknowledge that as a result of the eroded public trust that resulted in some of the actions of the Trump administration, that we didn't have as much public trust in the CDC and the FDA as was previous. Some folks felt like it was, that the Trump administration was pushing the CDC and the FDA to do things that could possibly create a vaccine that would be harmful. And what I want to reassure people is that scientists like myself, and I'm sure, I hope everybody has a scientific hero right now. Mine really is Dr. Fauci, who has held onto his scientific morals. And that's the one beauty I love of working with scientists, is that none of them laxed or relaxed their value systems or the way that science is conducted. And so as they've gone through these trials, they have done it ethically. It has been closely monitored. It has been closely tracked. And even though there were some missteps by our former administration that made us mistrustful in the CDC and the FDA, know that these scientists upheld the standards, like Dr. Fauci has, to make sure that these vaccines were safe and closely monitored. For those of you who do get vaccinated, I highly encourage you to sign up for this monitoring service that you can get with the CDC. They'll send you a text every day. You can let them know how you're feeling. That's one of the ways that we're tracking these side effects and seeing what people are going through as they get these vaccines. So I work in a frontline clinic. I was vaccinated early on. I think I was the third person to get vaccinated in Washington State. And we haven't seen any major impacts, but I was like, every time they text me, I would send it back because I had a sore arm, but my coworker got 101 temperature. How every body responds is going to be different. And the close monitoring and tracking of that will allow us to continue to monitor and to make sure that there is really continuous safety measures in place for getting the vaccine. And just one other thing too, the technology for the two current vaccines that have the emergency authorization, the mRNA technology, this wasn't created a year ago. That technology was created previously. It was what they did is they built these vaccines on already established good science. So these brilliant scientists who have maintained their scientific integrity, who are dedicated to ensuring that they are doing this well, used things that had already been discovered, which is how they were able to do this so quickly. So yes, some of the phases of clinical trials were smushed together when they would normally be further spread apart, but it was done with all these safety measures in place, continuous monitoring, and know that, the one thing that I've appreciated with the Biden administration is that they're working to rebuild that trust in the CDC and the FDA and in the National Institutes of Health so that the public can again start to begin to trust these processes. And we're seeing the success and knowing that we're going to get these vaccines out to all of our relatives.
Thank you for that. I also wanted to add, or I like to say that this technology that is used in the virus is older than Facebook. So they started working on it in the 90s, and we've had some degree of exposure with the SARS-CoV-1 virus, if everybody remembers that. And so it's been around for a while, and I just want to underscore that this is older than Facebook, everybody. Okay, so we know a little bit about the virus. That's helpful, or not the virus, the vaccines. What are some things, this is a question that came in, what are some things that people might want to do to prepare in anticipation of getting the vaccine? Folks are wondering if they have to take Advil or something before so they're not sore. Can you comment on that?
Sure, I can begin. We do not recommend what we call pre-medicating, taking Tylenol or Advil in advance. There, is maybe some theoretical notion, the theoretical potential, let me put it that way, that it could sort of blunt the body's immune system response. That's not been proven, but we want to be as cautious as possible. So we don't recommend it beforehand. But I think if afterwards, if someone is experiencing a lot of discomfort at the site where they receive the injection, or they've got a lot of fever and chills or muscle ache, it's fine to go ahead and take Tylenol or Advil. But I would emphasize that the vast majority of people don't have those severe symptoms. Generally, it's relatively mild. I received the vaccine, and I had some soreness in my arm after the first dose, and just felt a little bit kind of tired. But then after the second dose, I didn't feel anything. I felt completely fine, which was surprising. It's typically the reverse. Most people feel more symptoms after the second dose than the first dose if they are going to have symptoms. And interestingly, it seems younger people tend to have more symptoms than older people, which we think reflects the fact that their immune system, being very strong and vigorous, is responding well to the vaccine.
Yeah, and I had people say to me, should I take the day off work? The next day I was like, no, these are really mild symptoms. And some people experience some similar things when they get the flu vaccine, for example. And having a sore injection site, that's actually a good sign. You've had something injected into your body. It's a good sign that your body says, oh, this is weird, and responds in that way. So actually see those symptoms as a good thing. It's actually something that, you never look forward to a sore arm, but knowing that that's something that is a good response of your body as it's working towards building up your immune system, and it's having a response to something that has been injected into your arm. That's actually a good thing. So no need to take the next day off of work, and pre-preparing and really making sure that you're not doing the pre-medicating is also really important. And knowing that having mild symptoms, totally normal. We actually had, when the virus or when the vaccines first started, we actually started seeing nationwide what they were calling anxiety ER appointments. And people were coming and kind of rushing ERs with the like, oh my gosh, my arm is so sore, I can barely lift it. Or just they were feeling anxiety about it. So that anxiety doesn't need to take you to the ER, but know that it's also normal to have anxiety right now because we're in COVID. This has been stressful. So think about what I told people is like, when you come in and get the vaccine, think about that nice book that calms you down. What is the Netflix show that is just kind of funny and you laugh about? Maybe you want to, sit down and listen to some calm music. Recognizing that those body responses of anxiety can be a normal response too. And just taking the time to quiet yourself, think about, as a Native person, I think about how excited I am to build forward the health and well-being of my community by getting my vaccine and being a good ancestor. Those things can help calm too. So know that the anxiety you may get from feeling those mild symptoms, totally normal. Most of the time, you don't need to go to the ER for them. Just find those calming things, take a couple of deep breaths, and know you're making a decision on behalf of your family and your community.
And Abigail, I wanted to thank you for lifting up like the things that you do to calm yourself and how others are thinking about their community. That was actually one of the questions is, what can we do right now as Native people to not sort of feel those psychological effects? So thank you for mentioning that. Next question is, there's a lot of talk these days about variants. So how do we know if these vaccines can protect us against those, or whether we'll need booster shots in the future?
Again, another very, very good question. Let me first say we're not surprised that we're seeing variants. I want everybody to recognize that this is sort of the normal evolution that we see with viruses, particularly these RNA viruses, because they tend to, when they reproduce, they tend to make lots of mistakes when they reproduce their RNA, and they create what are called mutations. And that's a very, very common process. And most of the time it doesn't matter at all. The mutations don't result in any change in the nature of the virus, but every once in a while, there's a mutation or a combination of mutations that lead the virus to then have different characteristics. The virus can, with this combination of mutations, can be transmitted more easily, or it's possible the variant can now cause more severe illness, or it could potentially not be as responsive to the vaccine. Those are the variants that we worry about the most. And we are seeing some variants that raise concern, and they've gotten a lot of coverage again in the media. The first one was reported out of the United Kingdom or England, and and then another in South Africa, another in Brazil, and then very recently, one in California, and then in the news just the other day in New York as well. I get a little bit concerned because I think some of the press coverage is sort of sensationalizing things before we even fully understand what the significance of the variant is. Already people are sort of postulating that, it's going to cause all kinds of problems. It is true that some of the variants, particularly the South African variant, has not been as responsive to a couple of the vaccines. But even with its greater level of resistance, the vaccine seemed to be very effective in preventing severe disease and certainly in preventing death. And I think most of the experts believe that the vaccines are going to continue to be very effective against these variants over the near term. It's anybody's guess, though, over the longer term, what the need will be. So, for example, there may be a need for a booster every year. We just don't know yet. The good news with the messenger RNA vaccines is it's very easy to sort of adjust the vaccines to address these variants. Some of the more traditional vaccines are a little bit harder. For example, the flu vaccine, we really have to start preparing almost a year in advance to make sure we produce the right vaccine for the coming year. These messenger RNA vaccines, it seems, can be altered more quickly and adjusted more quickly to meet the needs as variants appear.
Yeah, so building off of that, we can all help prevent these variants from growing. How do we do that? Well, in order for them to replicate and make these mistakes, the virus needs to spread. So the actions that we take to stop the spread of COVID-19 is taking action to, not creating more variants of COVID-19. So wearing your mask, even if you've been vaccinated, you need to keep wearing your mask. Everybody still needs to do as much social distancing. You need to, take all these precautions to help stop the spread so that we can get more people vaccinated. And we can get, more moving towards herd immunity. So we can all take actions to help with the spread of these variants and the creation, as they mutate and they create variants. We can help make that less likely by taking all of these precautions, which is really important for every single person to continue to do. I will say that the United States has not been nearly as good as doing the genomic sequencing, which is how you discover where and how these, variants, where they're at. We have not been as good at testing our COVID, those who have been diagnosed with COVID to do the sequencing to discover these variants. So in Europe right now, we're finding that most countries are testing about 8 to 10% of all of their COVID cases to look and see where these variants are or what may be developing, whereas in the United States, we're doing in between 2 and 3%. So right now there's a real push from the scientific community for the United States to really start investing in doing more of these genomic sequencing so we can understand where the variants are, what the mutations are looking like, so that we can begin to prepare and ensure that we have the right vaccines for the right, for COVID-19. So we're seeing those actions starting to take. And it's another place that, you have an opportunity as a community member to advocate to your members of Congress and those who are funding these kinds of things for them to pay attention to what's going on, and that we do need to see the continuous investment in the scientific community in order to keep our communities safe as we work towards having, a community where we don't have to be in the midst of a pandemic at the height that we're at right now.
Abigail, I want to dig into something a little deeper of what you just said right now. You said when people get vaccinated, they still need to mask. And that reminds me of sort of what I'm seeing on social media where folks will be like, oh, I've gotten vaccinated. I got my second dose today, party time. Can you tell us from a scientific perspective why that shouldn't be the case? And you sort of touched on it already, but I just wanted to dig in a little more.
Yeah, we're finding that both of the vaccines that are currently have the emergency use are more than 90% effective. One of them is I'm spacing on the numbers right now, 94.1. The other is 95, I believe. And so that still leaves a percentage of possibilities of COVID-19. And one of the things Dr. Simon talked about is that even if you were to be vaccinated and you were to be part of that 5% that still got COVID, you are still less likely to have the significant symptoms that could put you in the hospital and put you at risk of death, is one of the things that is also one of the benefits of the vaccine. So there's still possibilities that you could contract COVID and that you could be the person who spread it to your family and to your community. So making sure that we're taking those precautions and social distancing, masking, following your state's and your county's recommendations on how many people should gather together. All of those things are public health precautions that are based off of science. It's just not some random group of administrators being like, oh, you know what, today I think it will be 6 feet apart. No, it is really based on the science of how far things spread when you speak. You know, if somebody comes in my office right now, why I will have a mask on if they come in. Those are really scientifically based decisions. They're not arbitrary. They are meant to protect you and your community, and continuing to take those precautions, even when you've gotten the vaccine, are absolutely key right now, because in this country, we are nowhere near at this point in time reaching herd immunity. And it is going to take the concerted efforts of all of us to take those safety precautions so that we can get to that point.
Thank you. So speaking of herd immunity, can you talk about how that fits into our value system of wanting to protect our communities, and basically explain what herd immunity is? And this can go to either panelist.
Well, I can talk about traditional value systems. I don't want to talk the whole time. I'm learning so much from Dr. Simon. But when I think about our traditional value systems and what it means, you know, in moving towards herd immunity, and I'm thinking of these villages in Alaska. So I'm from Alaska. I know what it means to be in a community of 150 people, of 1,000 people. You know everybody knows you, everybody knows your business. COVID's like that. COVID knows you, it knows your business, it's spreading, it's the gossip that's spreading around. You know, it's also, you know, those are the things that are inherent in our communities. And what we're looking to do is to make sure that we're not spreading something we shouldn't be, and that instead we're focusing and regrounding ourselves in this incredible responsibility we have. I always tell people, like, I'm so lucky. I know what my responsibility is every single day when I wake up. I know that I'm responsible to create a better world for my children and my children's children. I know that I have a responsibility to my community. That's what public health is, and that's who we are as Native people. So when we think about making decisions to mask, making a good decision about whether or not to get vaccinated, we are taking those traditional values and we were living them out as modern day people who are living in houses, but who practice our culture and tradition. And I think the outside world thinks about our cultural traditions as about, you know, like, oh, they go to powwows and dance. Like, our traditions are more than dancing, although I love that. Our traditions are living a life that is meant to be one that is part of a community as a whole, because we love each other so much that we would only want the best for our children's children. And it is our responsibility to create that better world for them. That's who we are as Native people. So when I think about our traditional healers here at the Seattle Indian Health Board, they're all vaccinated. They are encouraging our relatives, which is what we call our patients, to get vaccinated. They are traditional Indian medicine people who do our prayers, our songs, who practice our medicines. And they also recognize this Western technology of these vaccines as another way for them to serve our people. So they see it fitting in with our traditional values and our traditional medicine practices, that we're all about preparing our next generations for the greatest world. So when I see and talk about this, it's really focused on, I can't say it enough, how am I being a good ancestor today for my children's children's children of the future?
Thank you.
I guess I'll just talk about the broader society. I really do think it is a strength of your communities, that value regarding the community. It's very interesting and very sad, I think, that our society, our societal values have worked against us in this pandemic. The virus capitalized on our values, the fact that we prize individual liberty, freedom, more than almost anything else. And we bristled when there was talk about the need to restrict our individual freedoms to protect the broader society and our, our peers. And you look at the countries that have been most successful actually at controlling the pandemic, and it really has been those countries, I think, that worked in a much more collaborative way, where there was very consistent messaging, strong leadership, but also people that sort of believed in the system and were willing to make some sacrifices for the better good. And there were just over this past year, it was sort of nightmarish, the mixed messaging, the misinformation that was being promoted that raised so many doubts, the anti-science mentality, all worked against us. We've had now about 500,000 deaths in this country, and even under the best of circumstances, we would have had thousands of deaths, but it would have been many, many fewer. That's really been the tragedy, I think, of the last year. What's interesting about herd immunity is that it does really require the sense that we need to think about the betterment of the community. And in a community that's very individualistic, some might say, well, gee, why should I get the vaccine? Let me just let all the other people be vaccinated and then I'll be protected. And then if you have a lot of people saying that, you then don't have enough people being vaccinated to achieve that herd immunity. You really have to, I think, have a society or a culture where people do recognize the personal benefit, but also do appreciate and value the benefit to the community of being vaccinated. And then we're much more likely to reach that level. And we don't yet know really precisely what that level of vaccination coverage will be. I think the clue will be when we start to see the numbers dropping dramatically, very few hospitalizations, very, very few deaths. A large segment of our population vaccinated, then I think we'll be able to begin to relax some of the preventive measures that right now are so important, the distancing, the face coverings. I'm asked actually quite often, why, if we have to keep doing all these things, why should I be vaccinated if I can't, take off my mask or do the things I love to do? But it's going to take time, folks. Even when they're vaccinated, while they do have some protection, it's not complete. And it's only when I think we have enough vaccination coverage, we've reached that level of herd immunity where we're not seeing much transmission, seeing very few hospitalizations, hopefully no deaths, that we can begin to relax some of these, restrictions.
So what I think I heard Dr. Simon say is, in order to reach herd immunity, you have to think about the community and the greater good. So in other words, you have to think like a Native person.
I think that's, yeah. That's saying it takes a village to raise a child.
So Dr. Simon, in our last few minutes, I did want to ask some local questions. If folks are unable for some reason to access vaccines at our local Indian Health Service clinic, Urban Indian Health Organization, how can folks access it? So there's some confusion over city, county, now the state / FEMA sites. Like where's the first place that people should be looking?
So we have over 400 sites in across the county, but unfortunately not enough vaccine supply to meet the need. So even with all those sites, people are having a lot of difficulty getting an appointment because the appointments fill up so quickly. But I think it is important for everybody to know our website. It's vaccinatelacounty.com. We've tried to make it as user-friendly as possible. It has a lot of information about COVID-19 and also about the vaccine, and it also is a portal for people to try to make an appointment to be vaccinated. But we do recognize, though, that many people are not necessarily so comfortable using the internet, and so there is a phone number that people can call. It's 1-833-540-0473. They provide general information about COVID, but also information about how to get a vaccination. I was told the first several weeks that the call center went live, it was overwhelmed. We were getting more than 20,000 calls a day, and we sadly were not able to handle that volume, but I think it's quieted down a bit. I'm hoping it's better. I would say for any organization, though, that representing your community that wants to try to make it even easier, the best bet, I think, would be to work with a local healthcare organization in your area, because our sense is as the vaccine distribution system and the network pivots to the state, it's over the next few weeks will become a much more centralized system. The state will be running it. My sense is that they're going to be distributing a lot of vaccine through the healthcare system. We're advocating very strongly that they continue to provide community clinics and our federally qualified health centers with plenty of vaccine. And so I think an organization hopefully could partner with a community clinic. But if that's not possible, I would encourage you to reach out to us. And if you don't have a point of contact, you can always email me. My email is P as in Paul, SIMON at PH, which stands for public health, .lacounty.gov. And I'll connect you with the right person in our group that's doing the planning. We are trying to establish more of what we call pop-up sites at a location where we could vaccinate a group relatively, and we could help register them right at the site, which I think will make it easier.
Yeah, that's definitely something that I've heard would be helpful in communities like ours. So I wish that we could go longer, but in these last few minutes, a lot of folks are asking about resources. So you mentioned the county public health website, vaccinatelacounty.com. But I was hoping to ask Alexandra to introduce herself for a second and tell us about our more community-oriented resources and organizations and where they might be able to not only get vaccinated, but receive an abundance of other services.
Hi, Can you hear me?
Go ahead.
Hi, I'm Alexandra Valdes. I'm the Executive Director of the Los Angeles City County Native American Indian Commission. First, I want to thank our panelists so much for being here today. This was an incredibly informative panel, and I hope our community really got a lot from it. I wanted to remind the community that the Commission utilizes our website, which we're going to drop into the Facebook chat right now, as well as our Instagram handle, which is NAI Commission, which we're also dropping into the Facebook chat. We tend to use those to push out lots of resources, whether they're through American Indian, Alaska Native Serving CBOs or through the city and the county. As I sit within the county, I am always trying to find resources to connect to our community. So please check out our website, as well as our Instagram handle. Again, it'll be dropped in the Facebook chat or Facebook comments. And if all of these incredible organizations here, throughout this pandemic, our Native organizations have been working collectively to really meet the needs of our community, and they do everything under the sun. So I encourage you to check out the websites of all of the organizations on the logos that you see on the screen. And if you ever have any specific questions or are hitting a roadblock with a county service or a city service, please email me directly. I'll drop my email's on the screen. So I'm here as a resource as well, and I'm happy to help connect you. The city and the county are offering a lot of various services and resources right now, but I know sometimes it can be challenging to get through to somebody. So please reach out to me and I will do the best that I can to help you connect you to that resource. Thank you.
Excellent. So again, I want to be respectful of our panelists' time, but in these last 30 seconds, I just wanted to offer my profound gratitude to the expertise that has been shared with us today. Each and every one of you, I know Janelle, the audience can't see your camera, but I just wanted to make sure that, that you are also acknowledged in your role locally in what you're doing for UAII and the whole team there. Abigail, Thank you so much for everything. We definitely appreciate the truth and the power that you share with our community. Dr. Simon, thanks again for interfacing, being available to speak with our community. And we would definitely love to follow up on suggestions and recommendations that we have to help our community better access other means of the vaccine. I would love to discuss that, and maybe people on this panel would too. And again, to California Native Vote Project, thank you for your support of this event. And all of the organizations that you saw earlier who are a part of our LA Native COVID Working Group. Again, this group has been meeting since March of last year, every other week, and they're just extremely passionate. So thank you to everyone. By now, all of the pertinent follow-up information should be found in our chat. So reach out to us. We want to answer your questions and make sure that you get the information that you need to make the right decision for you. And with that, we'll go ahead and end it.
Thank you so much.
Thank you.